Hi, I'm Marc-Elie Nader. I'm a head and neck surgeon at UT/MD Anderson. And this is how to clean your ears safely. Ears are one of those rare systems in our body that can clean themselves. In the ear canal, we have cerumen glands, so glands that produce wax. And the wax acts as a protectant against germs. So it traps germs, bacteria, fungal elements, and also dust. And the ear canals shed skin, and as the skin is shed towards the outside, it acts like a conveyor belt, which pushes the wax out. Most patients do not need to clean their ears. They can just use a damp cloth to remove the excess wax that's at the opening of the ear canal. It's important for patients not to use cotton swabs because going blindly without being able to see in the ear canal, they will tend to push the wax deeper, make the wax more impacted. And especially in our cancer patients who have received radiation to the head and neck, the skin of the ear canal becomes more fragile. So there is a risk that by using a cotton swab or any other instrument, there can be damage to the skin of the ear canal, which can lead to an infection, and even in more severe cases, exposure of the bone of the ear canal. I think it's reasonable to use a cotton swab just on the outside of the ear to dry it or to apply any kind of ointment medication prescribed by the physician. But they should not go inside the ear canal with a swab. There are several wax removal products that people can buy over the counter. Some of them may not be safe to use. We recommend against the use of ear candles because one, they do not seem to be effective, and second, this hot wax can drip in the ear canal, causing damage to the skin of the ear canal, and also in some cases causing a perforation of the eardrum. There are some safe products that people can use at home to help clean the wax. One of them is mineral oil. They can use an ear dropper before taking a shower or taking a bath. This oil will lubricate the skin of the ear canal and will help liquefy the wax. Also, if the eardrum is intact, if there are no holes and there's no tube in the drum, patients may also use hydrogen peroxide that can help dissolve the wax. When patients use mineral oil or hydrogen peroxide, a simple way is just to tilt the head to the side, instill the drops and wait for a few seconds, and then just go back in the upright position and continue their activities. Although the ears tend to clean themselves, some people genetically will produce more wax that can overload the self-cleaning mechanism of the ear. And then when wax builds up and becomes compacted, it can lead to a blockage of the ear canal, which can then lead to hearing loss or a feeling of fullness in the ear. If the patient feels those symptoms and they do not improve within a few weeks, then the recommendation is for them to share this with their physician. Cancer patients may receive radiation to the head and neck, and the ears can be in the field of radiation. This radiation can affect the glands that produce wax, so the wax can become drier and it may be more easily impacted inside the ear canal. At the same time, the skin of the ear canal loses its self-cleaning mechanism, so we tend to see more wax buildup in these patients. Also, cancer patients may receive chemotherapy that can lead to hearing loss, especially cisplatin-based chemotherapy plans. So when patients perceive that they have new onset hearing loss, they should voice their concerns to their team. Finally, we have patients who use hearing aids, and the hearing aids can block the wax inside the ear canal and also cause more wax buildup that is more frequent. So they have to keep that in mind, and they may require a more frequent visit to their ENT to clean their ears. In conclusion, ears are self-cleaning, so most patients do not need to clean their ears. In some cases, they may need to use mineral oil to help soften the wax or use hydrogen peroxide to help dissolve the wax. And then if they have symptoms such as hearing loss or fullness of the ear that do not improve over time, they should voice these concerns to their team, who will then refer them to an ear specialist.